everybody. I'm Olivia F. Scott, and welcome to Behind the Ad, where we meet with industry leaders who are using marketing and advertising innovatively to equip you to do so as well. You know, artificial intelligence is changing how we target, talk to, and track audiences, but in health and wellness, the stakes are much higher than clicks or conversions. On this episode of Behind the Ad, I'm talking with industry award-winning and visionary healthcare leader, Kwame Terra, founder and CEO of bEHR Health Systems, an AI-powered wellness platform built specifically for Black communities. We'll dig into how bEHR uses data, algorithms, and culturally rooted storytelling to nudge behavior change, build trust, and create campaigns that feel like they come from the community, not from a lab. So if you're curious about where AI actually shows up in modern health marketing and how to use it without losing humanity, this conversation is for you. So, welcome, founder and CEO of bEHR Health. Welcome, Kwame. How are you?
I'm doing well, Olivia. Thanks for having me.
Thank you so much for joining us today. You're so busy. We saw you at NOE last week. You killed it. You educated us so much about your challenges. So happy to have you here.
Yeah.
So our first question is, for listeners who are unfamiliar with bEHR Health Systems, will you please enlighten us on the platform and the specific problem that you're solving?
Yeah, so we're a startup company based here in New Orleans, committed to maximizing health in the Black community.
Okay.
My first goal when I came up with the idea was to communicate clearly to the Black community our current health status. So if you think back to COVID, the virus was having a disproportionate effect on the Black community, and I just wanted to do something so that next pandemic or next challenge that we face, we're in better health to have a better outcome. And my first thought was that we don't know how bad we're doing. We know that we're not doing our best, but we know we should be eating better, we know we should be exercising more, but I don't think we're clear on the short and long-term implications of our current health status. And I thought it's a good time to get candid about that, because the life expectancy difference between Black people and the rest of the population is about 6 years. And when you extend that over the lifetime of the current Black community, about 50 million people, we're on track to lose 268 million years of time. That's time that can be invested in a variety of things to help grow our people, and we created bEHR Health to recapture that time.
Thank you so much. Tell us what bEHR stands for. I know it stands for, but tell us what it stands for again.
Yeah, so bEHR stands for Black Electronic Health Record. So electronic health records are these data systems that health systems or hospital systems use to keep track of everything. And bEHR Health is that, but for the Black community, as well as additional data points outside that take place outside of the clinic. So we have lifestyle data like your steps, and also psychological data like your mental well-being data. We also just take into consideration the whole person instead of just looking at when we connect with them in the clinic.
Got you. Okay, thank you so much. So talk to us about where AI is showing up in your work right now, whether segmentation, personalization, messaging, or product experience, and how that affects as a kind of advertising or outreach that you guys are doing.
Yeah, I mean, AI is really everywhere in our company now, and I really think it should be everywhere in everyone's companies. They should be using it to just make everything that they do more efficient, and them as a company be more productive. The first place that AI shows up is in the core feature of our product, which is a health score.
Okay.
So just like a credit score, it's similar in that way. Our number is 0 to 1,000, and it represents your overall health. We track over 100 different metrics across 7 categories of health. To give you that score: mental well-being, nutrition, mindfulness, sleep, physical or medical health. And your score isn't static, right? It's not like you go on the platform, you answer some questions, and you get a snapshot. Your score lives with you, so as you change, so does your score. So if you go on a run or a walk one day, your score goes up a few points. If you get 2 or 3 hours of sleep, your score goes down, and then based on those changes, we make recommendations for how you can improve, as well as connect you to healthcare providers, resources, and experiences to help elevate that score.
And so I want the highest score possible.
You want the highest score possible, yeah. The higher your score, the lower your risk for a significant health event on any given day. And the lower your score, the higher your risk is for a significant health event on any given day.
Okay.
And so we've seen, a wide range of health scores on our app so far, and for the most part, we are skewing to the low or fair range. But we knew that, right? We knew that we weren't doing as well as we should be as it relates to our health in the Black community.
Right.
And so that wasn't a surprise to see that data. But since we've been tracking what we call the health score report, each month, the average health score amongst everyone in our community has been going up by about a point per month. And that's really encouraging to see, and then we can use that data to determine, okay, what kind of new intervention should we roll out? What do we need to double down on that's working to continue to improve these outcomes?
So how are you using AI with that? Like, what is the AI component of the scoring?
Yeah, so the scoring in the real-time nature of it is the AI component. Yeah, so basically whenever I go on a run, right, it takes that into consideration. It looks at my heart rate from that run. It looks at my pace from that run, and it goes and it influences the score in that way. And I also have this side quest challenge that I started really for myself, so that I can just develop more of a connection and skill set around AI. So I discovered this new tool called Lovable.dev, and it's basically a platform where you talk to it like ChatGPT, but it produces apps and websites as a result of the conversations that you have. So I've come up with probably about 5 solutions in the past 2 weeks using this.
Wow.
And that inspired me to start a challenge where I create a new product using AI every week for the next 52 weeks. So I've released a couple so far. The first one's New Orleans Black Owned.
Okay.
It's a Black owned business directory for all businesses here in New Orleans. We have about 675 businesses listed on there now. Businesses can go in and update their profiles. People can also log support of businesses, so we can see how many dollars are being circulated in our community. So really driving engagement on that platform beyond just like a directory list.
Okay.
Did something similar for Black Run Clubs in the U.S. So we have about 183 Black Run Clubs listed on our blackrun.clubsnearme.com.
Okay.
Another tool I created with AI. And a few more coming up that I haven't announced yet. But every week I'm doing a release on Fridays.
Fantastic. I wish you well with that.
Yeah, appreciate it.
And so are you finding that what do you find in your experience to be with AI?
Just you can get from idea to product, and then putting that product into the market and getting feedback a lot quicker.
Okay.
Right? A lot of us will spend so much time thinking about the perfect product before we even start building it, right? So there's that. And then once we build it, we have to make sure that it's perfect before we put it out.
Okay.
And so what this tool is doing, it's allowing me to go from idea literally within minutes to product. And then I know that it's important to get feedback from reality as quickly as possible so that you can iterate and modify the tool so that it can meet the needs that people kind of communicate to you.
Yeah.
Versus you just kind of going back and forth in your head
Yeah.
about what you think is needed or what you think is good. Just put it out there so that people can experience it. And then as soon as someone gives me feedback, I can just go back to the tool and say, hey, modify this way to meet that need. And then within minutes, it's republished.
So it's supporting you as a business development partner.
Yes, absolutely.
A knowledge partner.
Absolutely.
That's amazing. From a demographic perspective, can you share who's mostly using your Bear app? Is it mostly 18 to 24, 18 to 34, 25 to 54, 25 to 84? Like, who's?
Yeah, there's a range. I would say it's probably like 25 to 45 is probably the most popular demographic on the platform.
Okay.
Although I would say the most engaged is middle-aged Black women.
Okay.
Right? Steps challenges are a big thing on our platform, and just turns out that middle-aged Black women are really into steps challenges.
So how are you advertising Bear Health and the app? How are you getting people, more users, to find it?
Yeah, we've advertised in a variety of ways. We launched our company in 2024, launched our app with Mardi Gras Steps Challenge, which is a challenge where whoever took the most steps on our app during Mardi Gras won $5,000. So we promoted that primarily through social media, some email channels, and about 115 people joined that challenge. You had to be a paying member of Bear Health to be eligible for the incentive. And then we just told those stories over time. And that led to more and more stories about steps, right? Dr. Eric Griggs, local here in New Orleans, he did 1 million steps in 30 days on our app and lost 20 pounds and got taken off his blood pressure medication. Well, then now we take that story and share that story with people, and that has inspired others to do the same. 5 or 6 people in 2024, that same year, also completed 1 million steps, losing 20 plus pounds each. Okay. And it's just finding one individual to impact and then telling that story and hoping that other people resonate with that.
Gotcha. All right. So you're essentially trying to change both habits and systems. How do you measure success beyond downloads or clicks? What are the signals that tell you this campaign's actually improving lives?
Yeah, so I mean, our first goal was to predict, prevent, and reverse the chronic conditions that plague our community. And with the story with Dr. Griggs, right, he already was aware of his current health status, but on some level, through engaging with us and through that challenge, he reversed it. He no longer is dealing with hypertension, and that's all that we wanted to do.
Yeah.
And if that happens with one person, if that happens with 10 people, if that happens with 1,000 people, like, we have accomplished our goal, and now it's just about fine-tuning that solution.
In health and wellness marketing in general, there's a fine line, and you know this, between motivating people and making them feel blamed or overwhelmed. How do you think about tone, language, and imagery so that your brand feels like a partner and not a critic?
Yeah, so the current healthcare system's primary objective is disease management, and it does a great job of disease management. It lets people know that they have a condition, then it prescribes a medication for that condition, but it doesn't do much to transition them out of that condition.
Right.
We want to do something different at Bear Health, and I don't want to create a culture or create a brand where everybody's just obsessed with tracking the details, every detail of their life, every calorie that they burn, every calorie that they consume, every step that they take, because that's not life.
Right.
I want to help people create a health promoting life experience.
It's a livelihood. Health and wellness is like a lifestyle.
Yeah. So instead of focusing on, you need to take this many steps per day, you need to eat this many calories, I just say participate in this challenge. The outcome of that challenge is that you did complete, the desired amount of steps per day, that you did burn this many calories, but it didn't feel like it was some prescription or me telling you what to do with your life. It was just you're participating in life in a different way now, and it leads to healthier outcomes.
And tell us about the incentives as well, because you incentivize these challenges, which I think really, really supports humanity, right?
Mm-hmm.
Because we as human beings, we need to be motivated. We need to be
Absolutely.
encouraged. We need to have rewards and awards, like to participate in life. So just tell us a little bit about that too.
Yeah, like I said, the first one that we did was the Mardi Gras Steps Challenge. Whoever took the most steps on our app won $5,000. That was, I'm pretty ambitious, I guess, when it comes to incentives. I don't know, it's like I want to get people on the platform. I want to get people engaged with what we're doing. And that was the very beginning too. So, that us coming out the gate as a company. And so I wanted to make a statement. The 1 million steps challenges, where people completed 1 million steps in 30 days, all of those were self-motivated. We didn't have any incentives for that. Those were just people wanting to accomplish that on their own, which I really appreciated that, because again, that's a lot more sustainable for us as a company, and also sustainable for them as a person, because if you can be self-motivated to transform your life, that's better. It doesn't rely on any external influence at all. So that's been really encouraging to see. We actually gave away two tickets to Super Bowl 59 last year. During COVID, or not during COVID, when the Super Bowl was here in New Orleans. So if you took 59,000 steps in a week, you were entered in for a chance to win 2 tickets to Super Bowl 59. I don't know, maybe like 150 or so people joined that challenge. And it just so happened to be that it landed during that time that we had the snowstorm here in New Orleans. But we learned so much during that challenge, because people have a variety of excuses as to why they can't exercise or why they can't walk. And what happens in these challenges is that people figure it out, right? So we were all snowed in, couldn't go outside really, but the challenge was going on, and people needed to get their steps. And there was an additional incentive to where every 10,000 steps or every 1,000 steps or so past the 59,000 mark, you got 10 additional entries into the raffle. And so people hit the 59,000, but then they kept going past that. Well, people were walking back and forth in their apartments, people were walking outside in the snow. And when someone comes to me with I don't have time, or I can't do this, that, and the other to get to prioritize my health, now I have stories that I can reference of people figuring it out. And it just lets us know that whatever reason that we have for why we aren't doing something, it's really because we just haven't prioritized it enough or don't understand the risk enough. And so that's fundamentally our job, is to help people understand how critical it is.
As we're mentioning, Bear has executed successfully many walking challenges. Tell us more about your upcoming walking challenges and how people can join the Bear community.
Yeah, sure. So to join the community, just download the app in the App Store or the Google Play Store, Bear Health, that's bEHR Health. And our upcoming challenge is actually a continuation of a challenge that I did personally last year. So last year, I set the world record for the most steps in 30 days. So I did 2,007,178 steps in 30 days. And that was a really exciting challenge, but I learned a lot from that challenge. I learned about the power of inspiration. So when I set out to do it, it was just a campaign to raise awareness for the company. So I thought it'd get me some attention and get people engaged in that way. But I didn't know that it would inspire people. And looking back now, that's, people say that's obvious. That's something that would have happened.
Yeah.
But when I think about inspiration and the value that it has for helping people transform their lives, kind of going back to that self-motivation that people need, a lot of people aren't having a great time in life.
Yeah.
They don't have a solid reason for being, because to an extent sometimes it just feels like, what is all of this for?
Right.
But when people walked up to me during that challenge and they were so just excited about life because of this challenge, or excited about what I was doing, and saying things like, "You are my friends and I's inspiration," it let me know that it really is that simple to get people to change their lives by just becoming the best version of yourself and trying things that you've never done, becoming something that you've never become. And as a result, people on their own start to change their lives for the better. And that is the solution that I'm bringing. It's not a health tracking app where I'm hoping to instill in people the desire to live, a strong desire to live. Because if you aren't all that you can be, you suffer more than you have to, and so does everyone else around you. I came up with another challenge, which is called the Behrathon. And it's a month-long challenge where we as a community attempt to cover a certain distance for a specific goal. So this year is the official launch of Bear Health.
Okay.
And so our theme is Bear Health to the Moon.
Oh.
And our goal this year is for this challenge, which starts April 1st, is to cover enough distance as a community to reach the moon, which is 239,000 miles.
By how long?
In 30 days.
In 30 days.
Yep.
And so you need a lot of people to join that so that collectively you can achieve 239,000 miles.
That's right.
Thank you so much.
Yeah,
we appreciate you for making the time today. And for everyone watching today who might have been a little fearful or still might be fearful about AI and wondering about what it does, this is one really good example of how AI is being used to truly help advance people's lives, making people's desire to live better. And I really hope that you all will download the Bear Health app. Go to your app store. I know that I'm inspired, and I love that this is a company that's right here in New Orleans as well. Until the next episode, we'll see you soon. Bye.